All right. So moving on to the next topic. Um, it's about biofunctional dentistry. So we have our next speaker, Dr. Samir Nayyar. He's India's first biofunctional dentist, and he's a pioneer in medical ozone therapy as well. With his 17 years of expertise, he's at the forefront of integrating dental health and overall well being. His groundbreaking work in understanding the connection between dental issues and systemic health has helped countless individuals achieve better health outcomes. It's amazing how he brings in the connection between um, teeth misalignment, root canals. I mean, so much of connection between um, dental health and the systemic diseases, which is very, very often not spoken about and often overlooked. So today we have him to speak about how infected root canals have a significant link with the chronic diseases, including cancer. So over to you, Dr. Nayyar. It's always amazing to have you with us, bringing insights on different topics.
Thank you for inviting me here, ma'am. And I think this is the right time to sleep after having lunch. But I will start my topic by saying good morning to everyone. So, can you allow me to share my screen?
Yes, you can. We can see it.
Yeah. Okay. So, basically, infected root canals. This is the topic I would like to speak about today. So, infected root canals, they can have a potential link between the cancers we are going through. So, uh, okay. So I specialize in biofunctional dentistry. I also do medical ozone therapy. I do body pains. I treat body pains with the help of your teeth. I also do pinhole implantology. I work a lot on occlusion and TMJ. So our team, me and my whole team, we use advanced and latest techniques to find the root cause of different diseases in the body. So I'm just giving you an overview before telling you the potential link between the infected root canals and the cancer. So there is a world within your mouth. Uh, there are a lot of good bacteria as well as bad bacteria as well. But if your oral health is not good, then definitely you will land up into few of your the food deposits on your teeth, your cavities, mobile teeth, then your infection in the gums, infection in the root canals. A lot of things can give a good environment for the bad bacteria to grow. So our mouths are home to millions of microorganisms, and I collectively call them as oral microbiome. Therefore, your regular dental checkup is always essential. So, why regular dental checkups are always essential? Because I think your dental health is your overall health. So, if we make it a habit to visit dentists regularly, we can catch cavities, infections, or other dental concerns before they actually escalate. This proactive approach can definitely help us avoid more invasive procedures, uh, and we have to go for fillings, main fillings or root canals or deep gingival treatments or periodontal issues. So we can also prevent many problems in the body. You see, a balance of oral microbiome in having both good as well as bad bacteria is highly required in our mouth. So very important point I would like to mention is the tooth body connection, because teeth are not meant just for eating or just for smiling. Okay, that tooth is linked. Every tooth is linked to the particular organ or your spine, vertebrae, or your muscles. Everything, every tooth is related to that particular organ. Like we say that there are meridian points on our fingertips, on our ears, on our feet. Similarly, there are meridian points on the occlusal surfaces, top surfaces of our teeth. Not only our back teeth, but our front teeth as well. So I love practicing biofunctional dentistry. It's a combination of biological dentistry and functional dentistry. So in biological dentistry, I'll just give you a brief about what I do. In biological dentistry, we take care of the oral microbiome. We keep the clean teeth, your gums, your periodontium healthy by using by cleaning them regularly, and I also use ozone medical ozone therapy to kill the bacteria with ozone and aid enhance the healing process. And we also don't use metallic fillings like mercury fillings. Dr. Thomas already told about the mercury fillings, how dangerous they are. They can even lead to many cancers also, and in other aspects also. And in functional dentistry, I work on the balancing of the forces on the teeth. I will just share a small insight that how unbalanced forces on our teeth can actually lead to different problems in the body. See, what I do is I focus on I identify where pressure is unevenly distributed on a tooth. The teeth are naturally designed to handle pressure on one side. Like this is, I think if you can see that. On the left side, green side, let's suppose a tooth is uh, formed to bear the pressure on this side. But in case if the pressure on the red side towards the right side is there, due to any problem, if the tooth is decayed or the teeth are rotated or teeth are worn out, then the load on the other half will start putting pressure on the teeth, and it can lead to cracks. You can see the picture on the right side where the zoom in image is there of the tooth, where the crack has developed inside the enamel. So this is the place where bacteria actually start growing. They grow at a very less rate, but the way we eat food, if we are eating unhealthy food, some sticky food, or your fast foods, then this will uh, speed up the reaction of bacteria to grow further. So the pressure, just understand, if there is an imbalance of pressure, that is a real cause of your cavities. Your जो हम कहते हैं कीड़ा लग जाना दांत में, that is a real reason of the getting cavities in your teeth. So if we can say this, we can understand this, then we can also say that when pressure is balanced, if we can do something that we can remove the unwanted pressure on our teeth, then we can prevent getting caries on the teeth. So why we progress more about the caries? So you see the picture on the left is having, we can see that there are marks on this tooth towards the outer half of the tooth. So this is the maxillary tooth or our upper tooth. This tooth is formed by the body to bear pressure on the inner aspect only, on the left side of this tooth that is being uh, given in the picture. So if in case there is a pressure on the outer half, this will create cracks inside the enamel in the center, either in the center or near the roots in the gums. So this is a place where the bacteria will start colonizing. And if we are not taking care of this particular single pit also, then if we are taking unhealthy food, our bacterial colonies will start multiplying at a much faster rate. So once the tooth decay begins, it can lead to the need for a root canal treatment to prevent this change, starting the uneven pressure on your teeth, leading to cavities and then requiring RCT. It is really important to have regular checkups with your biofunctional dentist. So basically, being a biofunctional dentist, I take care on balancing these pressures on the teeth so that we can prevent this problem in the body. So this is how the infection progresses to the root canals. First, it starts from enamel with a small pit. Then it progresses downwards towards the roots. Then the white is the enamel. The second layer is the dentine. Then it goes down from the dentine to the pulpal tissue to your root canals, and from your root canals, making them dead. They just with a, when they pass from the root canals to the bone, the infection, the bacteria, they just non-vitalize your root canals. Means you don't have any sensations, no nerve supply or blood supply left in your root canals. So any treatment plan in a patient, I think Dr. Thomas has already told that they definitely clean the jaw for every cancer patients. That is the best thing I think he has. What I like about this conference this morning, I try to take up a point from there. So if you are having any problem, any cancer in your body, you first diagnose your jaw. So, if any treatment plan, I think for a patient who is having any breast cancer or any other cancer, that does not include proper extraction of these infected root canal treated teeth or any other infected teeth, then I think it's not a complete treatment. And also, if many people are taking care of the cancers, and if I think they don't take care of the jaws, then the remission can always occur. So the cause of cancer must be eliminated along with the cancer itself, definitely in any complete cancer treatment protocol. So as Dr. Weston Price did a lot of research on this thing, and he said that the first step to recovery from any degenerative disease often includes the removal of all the infected root canals in the patient's mouth. So I would like to just show you how root canal treatment actually, we do the root canal treatments. So we just clean up the carious part and open the root canals. Then we remove these nerves and blood supplies from the root canals, making it a completely dead tissue. And then we fill these root canal fillings, root canals with a special gatta parcha fillings, and then we give a uh, filling above that. So root canal treatment, uh, it's actually a paradox. It's meant to save the tooth that could be lost, but in doing so, we actually strip away the living tissue, including the nerves and blood supply from the tooth. So while we keep the tooth, it's like keeping something that used to be alive and vibrated one time, but right now it's not vital. So in our quest to hold on to this, we end up with a lifeless reminder. That's why I call root canal treated tooth as a dead tooth. So basically, in infected root canal, they have been identified. They have means a lot of people are working on these infected root canals now, and they have found these infections around the tooth. You can just see a radiolucent area around the root of the tip. This could contain a lot of fungi, viruses, and they have over 460 types of bacteria. So definitely, no matter what you do, you cannot sterilize the root canal system 100%. And successful procedure results in a pain-free, well-sealed, but still infected tooth. So basically, root canal treated teeth, or I would say that the dead teeth, it's a chronic pathogen colonization hub. It's capable of generating a lot of highly potent pathogenic related toxins, which can be these can be identified as the radiolucent areas around the teeth, around the roots of the teeth. So why we call it's a pain free, because the large zone of radiolucency is generally occupied in these individuals by a highly vascularized defensive tissue whose functions appears to be chiefly that of a local quarantine station. So our basically system quarantine this low area uh, by a by our immune system. So when it is adequate and efficient, when our immune system is adequate, it's fighting properly, the balance of the body is being protected. Balanced body is protected. But if when the patient has overload, such as any other illness or poor nutrition also, he is unable to continue the maintenance of the adequate quarantine around that tooth. And the organisms or the microorganisms that are present under the root canals and their toxic products, they pass into the body. So this is this is an example of pain-free abscess. So you can see a small opening around the gums. We say that we got means patient used to come to me and they say, "Doc, I got some pus is coming out from the gums." This is actually the from the root canal infections. So when it enters into the body, these accumulated toxins and pathogens, they produce general changes in the blood and the warfare. The final warfare, we can say that may have to be made in various organs or tissues in the body far away from the source of infections, that is the root canal treated tooth or any infected tooth. So the local dental involvement now ceases to be uncomfortable. So patients think there is no problem in the tooth, but actually this problem has already uh, gone to other tissues and organs. So this is our drainage system. That actually from the draining veins and lymphatic system, these pathogens they actually go to different parts of the body. So first we can see that these toxins can go from your venous system. From the venous system, they actually go to your coronary arteries and then the cerebral arteries. And from the lymphatic system, they can go to lymphatic circulation of your chest, your breast, the area below these jaws, your neck, your chest, breast, and other organs related to these. So, due to the chronically abscessed these teeth, the draining lymphatics and veins of the jaw, they make significant changes in the body. First one I would like to tell you is the antioxidant depletion. So if there is more, if the oxidative stress is increased, antioxidant level is decreased. That is a vice versa thing. So this is the most likely to occur to the greatest degree in the head, neck, and the chest via lymphatics and coronary. And I told you that the cerebral arteries via the venous drainage. So once the pathogen and toxins they enter your venous drainage, they can lead to different problems in the heart and your cardiovascular system. So second impact is that we have noticed in our blood reports is decreased levels of ionic calcium. So the ionic calcium, I won't go into much detail, but I would just try to tell you the three types of problems that can that one individual can have. The number one is high or normal blood ionic calcium levels, and the bactericidal efficiency of the blood is also good. Number two is chronic blood ionic calcium is usually below their normal levels, and the bactericidal efficiency of the blood is also low. And the third group is ionic calcium levels tend to have a very low level as compared to your normal levels, and the bactericidal efficiency is extremely low in such patients. These can lead to different types of issues in the body. So thirdly, the increased levels of lymphocytes, your decreased levels of polymorphonuclear leukocytes. So Dr. Weston Price did an experiment. He planted infected root canal treated teeth beneath the skin of a rabbit. One of the two means he did a lot of good study on that. I'll just tell you one or two things about this. The first one would be either the animal will build an encapsulating area around the highly vascularized area around the infected root canal that will protect it from toxic and bacterial elements and with very little change in your weight, blood chemistry, or general health. Second one could be no vascularization structure is formed around that tooth. So which may be accompanied by a considerable exudate or pus, and the animal loses the weight. suffers a reduction in its ionic calcium levels, and subsequently it dies. So basically, what we understand from this study is, if your body is well, your immune system is well, is very good, then it will protect you for a very longer time. So oxidative stress infected root canals. So cancer, especially breast cancer, as Dr. Thomas told, that never arises in the absence of on-site massive increases. Oh, never. Sorry, there is a massive increase of oxidative stress from the pathogens that are draining from the oral cavity, and I would suggest, if any woman is having any breast cancer condition, they should first see a biological dentist and not a traditional dentist, and get a 3D X-ray of their mouth and go and check if they have any infections in the jawbone. If they do have any infections in the jawbone, definitely they should take care of the jaws first. So diagnosis can be done like Dr. Harsh Mahajan already told, that there are a lot of good techniques nowadays available, that we can uh, definitely check a lot of things in the body. So different type of modalities can be done. So tonsils, I think I will not take much time on this slide. Tonsils should always be treated as though they are infected, because uh, if the tooth is infected, either the root canal or any other tooth, the tonsils basically they help to uh, take out that load, that infection from the body, from the jaws. So if even the tonsils, even a tonsil has drained a root canal or other infected tooth, even for a smaller length of time, it cannot recover, if even if that tooth is extracted. Rather, it becomes a source of chronic focal infection. So the pathogens and toxins can definitely seep into the body through these tonsils. So the tonsil should be treated, because the cause of cancer must be eliminated along with the cancer itself in any complete cancer cure treatment. So the role of biological dentists here, they help to improve the overall health of its patients more than any other health oriented profession. So the first and foremost that he will do is thorough examination of all of his patient with the different type of X-ray modalities, uh, or we also do that intraoral scanning. We also check the teeth, gums, your muscles, everything clinically also. So we use a biological or a holistic way to remove all the infections from the body, and also the heavy metal fillings. I love using ozone. I use ozone in every aspect of my dentistry. I don't use any antibiotics or any painkillers. We definitely extract these infected teeth more biologically by using ozone therapy. Basically, we also, after extraction, also before extraction, we do a lot of ozone therapy. This is ozonated saline. We are actually irrigating with the extracted socket. We also give ozone injections in the bone. We give, this is ozone insufflation. We are doing after the extraction. A lot of procedures we use, in a lot of procedure we use ozone. We actually don't just remove the tooth. We also sterilize the bone around that tooth. Just removing that tooth is the our work is not completed. The infection that has already been inside the bone because of this root canal infection, infected root canals or infected teeth, we need to sterilize those areas as well. So if you have got, I would like to tell you that many patients come to me, doc, I got this root canal treated, tooth removed biological way. What if I don't want to get it replaced? So if we are not going to replace that particular tooth with any other modality, you can see the tooth, the other teeth around the that extracted tooth, above that tooth, they will start moving to different directions towards the space that is being available for the teeth to grow. So this will further cause different types of infections in the teeth. You can appreciate in this video, when the teeth move towards the empty space, there will be more spaces with these red dots, and these there will be lot of caries, lot of bacterial colonies developing in these gums and teeth. So we should also think about replacing these teeth also. So we basically check the uneven pressures on our teeth, which can lead to dental problems. And if you have any type of malalignment, we try to balance those forces with by aligning your teeth. Mostly traditionally people do this with braces, but definitely we cannot. According to my understanding, because I also got these braces, whatever we can do, we cannot clean these metal braces properly from all the aspects. So some bacteria will definitely grow inside these braces or under these braces or inside the wires. So what I typically do is I basically use these functional liners. They are the clear aligners. So no one notices, actually can notice the that you are wearing aligners. So in the functional liners, we basically line your teeth very gradually. So we try to, I already told you that the caries start because of the imbalance of the forces on the teeth. So what we do is we basically do use functional liners and maintain the forces on the teeth. So we just try to balance your body with the help of your teeth by using functional aligners. So one thing I would like to tell you means, if from my whole conversation, if you are not going to understand anything, just do one thing: buy a water flosser. You can easily buy it from Amazon or Flipkart, any online site. Just type water flosser. You will get different types of water flosser. Different companies are coming. Use that water flosser with the water you basically use to drink, and clean your teeth and gums completely every night before sleeping. And if in case you have uh, more spaces in your gums, you should use this water flosser after every meal. So your the healthier you starts from your mouth. You should take care of your mouth first. And remember, healthy mouth is a gateway to a healthier body. And what I focus more is on, I focus more on children now, because this the age group of 12 to 14 years, and even before that we give some appliances also, myofunctional appliances if possible. But age group of 12 to 14 years is the ideal age to align your teeth, because we can grow your bone accordingly, we can take care of your gums accordingly. A lot of things we can take care with our in this age group also. And moreover, we can also take care of your, we can prevent many problems if we are going to align your teeth in this age group. Mostly people come to earlier, people used to come to us, only adults used to come to us, maybe in the age of 30, 40, 50, 60. We have given functional liners to the people who are above 65 as well. Age is just a number. If your teeth are not mobile right now, we can also give functional liners to any age. So if you really want to prevent these diseases in the future for your children, 12 to 14 years is the ideal age to give functional liners to them, so that in the future they won't get these kinds of problems, if they are causing, if your teeth is basically they are the causing causative factors. So we basically work in Jalandhar. I also go to Chandigarh and also go to Mumbai. So if you want to contact me, you are always welcome.
Thank you so much for a very, very informative presentation. I'm pretty sure the participants are appreciating about the same. And I would just quickly take a question, which was a very common question. How do we check if we have an infected root canal?
Just get one X-ray done, full mouth X-ray or OPG, or also you can go with your dentist and ask them to do one X-ray.
All right. All right. Thank you so much.